a 9-month collaborative aimed at attracting and retaining patients, and it sounds like such a wonderful initiative. Could you each share with us what market segment you're working to attract?
We're working to attract the 5 to 11-year-olds who are at risk for obesity.
Okay.
We at South Central are working to attract or increase our prenatal prenatal patients.
LACUSC Medical Center is working toward retaining and attracting our adolescent population, 12 to 21 years of age.
For JWCH, we are retracting the pediatric department.
El Monte Comprehensive Health Center, we're trying to improve our patient population in pediatric clinic, which is 0 to 18 years old.
Okay. Very interesting. Thank you. So you've all chosen your market segment now, and from what I've read and what I understand about the project, the next step is for you to do a bit of research. Is that correct?
That's correct.
Okay. So if you could just share with us what you've done to understand more about your market segment. What kind of marketing consumer analysis did you do to understand your environment, the demographic, what your competitors are doing? If you could each share that with us. And we're just going to share.
Los Angeles Christian Health Centers. We were looking at the data from the census,
Okay.
so we were looking at our overweight, obese children, and so we found that, like in LA County in 2007, 22.9% of the children were considered obese, and
Wow.
so an additional 19.4% were overweight. So this is like almost a third of the population
Right.
of LA County children are overweight. So we could see that that was a really, and it seems almost to be increasing, although we've also found that the schools, because the schools have done a little more work to do things such as remove sodas for LA Unified,
Okay. Yeah.
and other such things, then there was a little bit of a leveling off. So our data, it may have come from 2007, but it sort of began to level off when the schools began to do things. But the population is so huge in this group that the demand continues. So we looked at that, and we looked at all the census data and the materials that we received from the collaborative were very helpful.
Okay, and the census data is the 2010 is not out yet, right?
That's right. That's why we had to go with what we had, and then we kind of could see the trends.
Okay, but it might be interesting to see the 2010 data compared to what you have now and see if the interventions the schools are doing and things like that are making a difference.
Yes.
Okay. South Central could share.
What we did, we also did some research, and we found that our market segment is 83,000 in our spot 7, and 50% of them are unemployed. And due to that, of course, we have a range of, we're going to target the ages between 16 and 36 years old for the prenatal department, and to give them, preventative, of course, services for the teens, and then for those that are going to be getting services for pregnancy, we have all that available if they don't have insurance, being that they're 50% unemployed.
Yeah, and it sounded like we heard a commercial from you earlier where you have a very competitive sliding scale program.
Correct.
Okay, so that's great. So you're taking that data and that information and applying it.
Yes, we,
as you need to.
as well as those that have the teens and babies and those that don't have insurance will be able to pay with the minimum cost.
Okay, that's great. Thank you.
Okay, well at LACUSC, the team utilized various data and resources to obtain our information. We used some information from the census, from our spa area, but more importantly, we decided that we were going to focus in specifically within our medical center. We already have a group there that we really need to tap into.
Okay.
So a lot of our information was obtained from the medical center, our workload stats, particularly the ambulatory workload stats. The medical center sees nearly 750,000 patients a year.
Wow.
And the pediatric population, we actually see, well, in our pediatric clinic, we see anywhere from about 5,000 to 6,000 a month.
A month?
Mhm.
Okay.
And, but we also have a particular population we also want to focus in on, because we have the OMC, Office of Managed Care, CHP Managed Care
Okay.
patients, which are already enrolled into our medical center, and we're trying to tap into those, and we have nearly 1,000 enrollees.
Okay.
And we're trying to tap into those particular patients, which are the adolescents, and trying to get them to come in.
Okay.
So we have a low compliance, and overall, it's about a 50% show rate
Okay.
for them. So we really want to try to track them and bring them in. And a couple of things we've done was, again, like I said, collect the data, and we also did some surveys of that particular population, and to discover that they mostly come because this is where their mother brings them.
Okay.
And mother was used a lot, so it was
Very
more than 70% of them. So, and they've been coming since birth. So
Okay.
if we can keep mama happy and keep them coming since they're born, we're going to be able to maintain them there. And the other thing we discovered is that we really need to focus on something that will meet their needs, and that's the afternoon or later hours.
Okay.
And they really highlighted that in the survey.
Okay. We actually want to hear more about, from the other organizations about what you were able to do around the surveys, and I know that you've done other things to try and extract that information about what they need and want. So we're glad that you were able to get some of that information. Also, it seems like you have an advantage because you have staff on site already collecting data that some of the other organizations probably had to dig a little bit deeper for. So you know some of your population numbers and who they are and why they're coming. So very interesting. Thank you. JWCH, if you could share what you found out about your market, the environment, and their demographic.
We actually had a focus group. We planned to have two, but unfortunately we couldn't have another one. But we brought in from grandparents to parents, and we really wanted to know what their needs and wants. So we had one focus group where we had negative and positives as to we love our doctor, which treats us really well. And then we had also the negative side where the waiting time was a little long, but but I don't have the percentage as to how many patients we have. And we really found out a lot of great ideas from our clinic. We also have, they said that it was a nice clinic, a nice place,
Okay.
a lot of parking, and things like this. And we had also from the ages from 0 to 18 years. And
As part of your focus group, 0 to 18?
no, actually the parents, but I'm talking about patients.
Okay, so that's who you're
Yeah.
focused on.
Yeah, so we had a lot of great ideas from the parents,
Okay,
and we had a lot of fun doing all of these
I'm
things.
sure.
And I actually have a copy here, which, you know,
Is that your script or the responses?
the responses from the patients.
Okay, we'll love to hear that and actually dig deeper on that, but before we go to commercial break, we're going to just hear from our last respondent on their market analysis and consumer analysis.
Okay, so in order for us to understand a market segment that we chose in El Monte, we did two surveys. One survey is based in the clinic, which we call it the Pediatric Clinic Focus Survey.
Okay.
We did it for 1 week, and our target at that time was to target directly the patients and the parents in the pediatric clinic. We went also to women's clinic and adult services, wherein they are moms or guardians or grandparents who has or who have children at their houses 0 to 18. So we also did survey to those population. At the same time, we also did understand our market segment outside our clinic area.
Okay.
So what we did, our care manager or our outreach coordinator, the team, we developed a questionnaire. It's a standard questionnaire that we use this questionnaire and we called the 21 clinics around our area, which is like 15 miles within our area, which we consider our close competitors.
Okay.
So we want to understand, why are we losing our market segment? Why are we losing our pediatric patients over to this clinic around the area? What do we don't have that they have?
Right.
What do they have that we cannot have? So by all the answers we got, then we were able to understand and derive our SWOT analysis. And we use those answers to make sure that we will implement those in our clinic so that we can get them back, we can retain and attract them.
Wow, very, very interesting. And when we come back, I want to dig a little bit deeper on that and see what you found. But right now we're going to hear a word from our sponsor, LAC USC.